It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Up first on our show today, we're going to hear about hip revision with Dr. Henry Small.
Hip revisions happen for several reasons. The one was they just came loose, and they can come loose just because they were never put in correctly, or sometimes they just come loose. And the second reason is infection. About 2.5% of the hips put in nationwide get infected, and once they're infected, they have to come out and you have to start over. Occasionally, I see, like this patient we did recently had been infected for several years. I'd already revised her other hip that was infected, but she's in bad health and she was in a nursing home for many years and had not walked until we revised the first hip. She had not walked in 2 years, and then after revising the first one, she actually got out of bed and was able to ambulate her in the house and for short distances. But the second hip, which had been chronically infected, eventually put her back in the bed and was bedridden. And so we just replaced hers recently. And in this case, her femur was broken in several places. The infection was really bad. I mean, just a very complex 7-hour surgery. But it looks good. 20 years ago, the mortality rate from a hip fracture was around 40% of the people died within the first year. And currently that number is around 10 to 15%. And the difference is fixing it, replacing it more often than trying to fix it, replace it with a new hip, and get out of bed and get back, just get back to activity as soon as we can. I think that hip replacements, for the most part, have just been one of the few miracles of modern science. I mean, you take somebody who's either has arthritis or a broken hip that literally cannot function in life, the pain is so severe, and then do a typical normal hip replacement is an hour surgery. And you can have a hip that's absolutely normal. In fact, 95% of the hips get so good that people forget they had one. And it becomes a normal hip, and they can go on with their life and do everything in the life that they want to do, with extremely few restrictions once they're healed up. I really love what I do, but what I love most is trying to take somebody whose life is really just totally destroyed because of what's wrong with them, because of pain or disability, and trying to get their life back. And that encompasses much more than just the surgery. And that's what I enjoy. It's getting someone's life back.
Stretching can help boost circulation and digestion, and even ease back pain. Remember when stretching to hold each position for about 25 seconds and to breathe deeply.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple, and I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process, and he said, you can always do more, but let's do something modest for now, and it's just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what what can actually be accomplished in surgery so that they do have realistic expectations, and we can kind of give them a good idea of what they actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time, I looked and thought, oh, my nose is adorable.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market. So many Americans are affected by acid reflux, but may not know that there's a solution. Up next, we're going to see how Dr. Cliff Thomas was able to help Zachary overcome his acid reflux. Let's take a look.
I'm studying music education and I'm studying opera. I have voice lessons twice a week. I have choir rehearsals every day. I have opera rehearsals all the time. And so I have to be in tip-top shape. And before this surgery, if I sang for more than 30 minutes, I was done.
So some people wonder what GERD is. What's going on is the esophagus is tube that goes from the back of the tongue down to the stomach. And at the bottom of the esophagus where it connects the stomach, there's a one-way valve that should let food and juice into your stomach but not let it back up into the esophagus. When it goes back up into the esophagus, it can burn the esophagus and then cause the symptoms like heartburn and coughing, asthma, a lot of symptoms.
Acid reflux all day, every day. I mean, I would eat, acid reflux. I would not eat, acid reflux. Have a drink of water, and so it was one of those things. I would wake up in the morning with a sore throat. It would affect my singing, like I said.
So I've been doing surgery laparoscopically for 22 years for reflux and have excellent results. And what we do is an outpatient procedure. Through very small incisions, we go in there and we reduce the hiatal hernia. So that's basically where there's a little gap in the diaphragm and the stomach's protruding up into the chest. So we pull that down and close that gap in the diaphragm and rebuild that one-way valve. The operation takes less than an hour. People usually go home an hour after surgery. They're usually doing everything within a week. And they're usually getting out of the house in 1 to 2 days after surgery.
Actually, I told Dr. Thomas the results of this have been amazing. The very, very first morning after my surgery, I woke up and I almost started crying, literally, because it was the first time in my entire life that I had woken up without a sore throat.
One of the more common things people tell me after surgery is this is one of the best things they've ever done in their entire life. So this heartburn symptoms kind of is in the background of their daily life, and it may not seem like the worst part of any one day, but when it goes away, their quality of life improves so much and they don't have to live with it. They're kind of ecstatic. It's
been an amazing, amazing improvement in my entire life, and it's something that I'm so, so grateful to have had done.
Carla has a question for Dr. Peter Morgan. What are the causes of venous insufficiency?
The risk factors or causes of venous insufficiency are, first of all, genetic or hereditary. Patients that have parents or grandparents or aunts or uncles that have large varicose veins are more likely to have disease that is caused by a genetic predisposition for the veins to get larger. The second risk factor is lifestyle issues, including jobs, occupations, or hobbies that result in standing or sitting for long periods of time.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
Wouldn't it be great if we had a blood test that could tell you if you had cancer or you don't have cancer? Well, we don't quite have that yet, at least for most cancers, and in the future we probably will. I would say within 5 years there will be tests that we can do on your blood that will tell us if you have a tendency towards certain cancers or if you even have cancer cells in your body. There's a lot of genetic testing and a lot of research going on, so there's great things are going to happen. Now, as it is now, there are certain tests, for example, for ovarian cancer. There's a test called CA125. You don't need that test unless you have a strong family history of things like cancer of the uterus or ovary cancer in your family. However, it is a good test and can tell us if that cancer is brewing. There are certain tests that help us with pancreas cancer. But in general, the blood test that you have when you do your physical give the doctor a clue as if you are at risk for cancer. For example, you might be anemic, or your platelets, which is part of your red blood cell count, may be high. There's also other things like liver tests that may be elevated and that indicate your cancer risk is high. So get your blood test done, check it out, and hopefully in the next 5 or 10 years there'll even be better blood tests.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
For years, I've been very self-conscious about my smile. I took some antibiotics as a teenager, and that permanently discolored my teeth. I tried bleaching professionally, I had tried in-home bleaching, tried buying stuff off the internet, everything I could think of, and nothing was working.
On her, we did the crown lengthening and gingivectomies to take the gum up, and then we did veneers across her upper and lower teeth, and then in the back we did crowns because they were kind of broken down and needed restorations. And we opened up her bite, and so it gives her a more youthful look. The whiteness of her teeth, you know, made her look great. It was just fabulous what it did for her.
Before I had my smile makeover, it affected even how I took pictures. You know, just in a social setting, somebody's snapping candid shots, and I would never, rarely would open my mouth to smile. You know, once I had the smile makeover, I'm just splashing the pearlies.
What I love about what I do is that it changes people's lives. It sounds kind of corny, maybe a little melodramatic, but people who have had a smile that they aren't happy with and that have been conscious of it their whole life and try to hide it, then you take that away and make it to where they can smile and they feel confident about their smile and confident about how their teeth look. It changes their life.
I think it was October when I had the final visit. That Christmas, I went to my brother's, and my mother was across the room from me. My mother's 82 years old, and she looked at me and she said, "Your smile is dazzling." And I was like, "Well, thank you." Before I came to see Dr. Lewis for my smile makeover, I was always self-conscious, a little fearful about trying new things or stepping out of my comfort zone, and after I feel like I can take on the world. I would just say that if anybody's considering a smile makeover with Dr. Lewis, they should go for it. Get your consultation, get in, you'll be happy.
For more information and to check out hundreds of videos on all of the amazing doctors you see on our show today, head to our website. It's bestdocsnetwork.com. Now it's on to our next best doctor. It's vein specialist, Dr. Peter Morgan.
ClariVein is a new procedure. It's been out maybe for a year or so. It is a procedure that is associated with less pain, both during the procedure and post-procedure. Patients that have venous insufficiency that don't have it corrected are going to get worse. The question is, how fast will it get worse and how bad will it ultimately get? And that's dependent on the individual, how much of their problem is hereditary or genetic and how much is occupational. The typical presenting signs and symptoms, which include pain, swelling, restless legs, enlarged refluxing vessels, if you have the venous insufficiency corrected, the disease progress will completely stop, and if it recurs, it can be easily treated without significant intervention. When you use a laser or radiofrequency ablation to close veins, it's an energy source that produces heat. And so you're essentially burning the veins using radiofrequency or laser. And in order to control that pain, you have to put a tumescent solution, which is a numbing medicine mixed with normal saline, around the vein all the way up the leg. And so that requires several needle sticks, which is uncomfortable, and then that makes the leg kind of full, maybe a little tight, and there's some leakage of the fluid. And with the ClariVein, that tumescence not needed, because ClariVein basically has a mechanical agitator, like a skip rope, that spins inside the vein and traumatizes the lining of the vein, and then we inject a sclerosant solution that augments the effect of the skip rope. When you use an energy source, there's always a risk that you could damage a structure that's adjacent to or near to the vein, such as a nerve or maybe even muscle, that sort of thing. And so with ClariVein, since there's no laser, there's no radio frequency, you're not using a heat source, and so it's, I think, significantly safer. All of the procedures are very safe statistically. The number of complications is very minimal, but I think there is some benefit with the ClariVein with respect to complications.
If you have asthma, don't let it stop you from playing sports. Swimming, canoeing, fishing, sailing, and walking are all asthma-friendly options.
Well, the issue, of course, is age and gravity. And so I wanted to do the Ultherapy because of it's a really nice lift without any incisions or downtime.
Skin tightening is basically taking a device and taking energy such as heat or radiofrequency energy or ultrasound and tightening the skin to a degree where you can actually see effects. The technology these days will actually harness the energy into a delivery system which is not as painful and gives us better results with less downtime.
I knew that the Ultherapy was immediate results. I knew that the downtime was 0. And I also knew that it would be a pretty general facelift, and that's what I wanted.
The Ultherapy procedure takes about an hour. There is no downtime. It's non-invasive, so you can have the procedure done and go back to work. There is no bruising associated with it since it is non-invasive. The effects of the Ultherapy last about 2 years. And with any type of procedure that you do for tightening, once you have the procedure done, your skin starts aging again.
Have it done. It makes you feel better. It makes your outlook a lot better because you look better, you feel better. And people notice. They don't know what you've done, but they notice that you look great. You look like you have a glow about you. What have you done?
Skin tightening industry these days is really about delivering the best type of energy to get the best type of results. So that's what I like to focus on here at Woodlands Wellness, is that we have researched to find the best procedures for the best results. When we do a procedure, you know that's FDA approved, and it's also going to do the best that we can do to get that result.
You don't have to tell anybody, but other people notice. And it has to do with the brightness in your eyes and just how you feel about yourself, and you want to get up and conquer the world.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment. University General Hospital is a hospital like no other, with state-of-the-art medical treatments in an inviting environment that pampers patients and families and encourages relaxation and healing. Jose has a question for Dr. Cliff Thomas. What are the side effects of acid reflux medication?
So the side effects from taking reflux medication that concerns people the most these days is osteoporosis. So there was a study that came out that suggested that people have increased risk. Now I'm not 100% convinced that's true, but nevertheless people are very concerned about that. And now there's a box warning that's saying that this is only FDA approved for 8 weeks of treatment, and very few people take it for 8 weeks. So it's really kind of the cat's been let out of the box that maybe taking this stuff long term is not a good idea. And the truth of it is the medications don't fix the problem. They can fix the problem of the juices eating away at your esophagus. They're pretty good at that, but they don't fix reflux, and they don't fix your risk of cancer of the esophagus.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple course of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what he can do for me and what would be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
On our website, bestdocsnetwork.com, all of the doctors that you see on our show today have profile pages with videos, bio, directions to their office. You can even request an appointment. Be sure to take a look. Now up next, we're going to hear from interventional cardiologist Dr. Annie Varghese and how she helped Jennifer overcome severe hypertension.
I noticed something wrong in July of 2008. I actually went to a routine doctor's visit for some breakout that I had, because I had used a different type of deodorant. And when they took my blood pressure, they said that it was, unusually high.
Hypertension, what can it cause? And some people think, well, their blood pressure is a little bit high, they can take a medicine, or maybe they just don't have to take it every day. A lot of people take this idea of hypertension kind of casually, but we shouldn't, because high blood pressure can cause problems from stroke to heart attack to kidney failure. So many things can be caused by that one word, hypertension.
Ended up inevitably going to the emergency room like a couple of days after, because I just started feeling really dizzy, headache. It was as if my heart was actually hurting inside of my body. The blood pressure was 200 over 110. When I came to see her, her first words were, "We're going to heal you." And I was like, yes, came to the right place.
She has been committed and faithful to take her medicines and to take care of her body, to protect her heart, because high blood pressure can lead to many other things, especially cardiomyopathies or weakening of the heart, heart failure from diastolic heart failure, or systolic heart failure. So we have prevented that in her, and she's doing very well.
Before, I would feel sluggish, tired, anxious a lot, and a little headaches like that. And then after, you know, once we started treatment on medicine, different medicines, you know, I would feel better. I would feel like I had energy. I just felt better and good about myself.
If the pressure is too high, too much damage can occur in the organs. We have to take it seriously, and we just need to educate patients, I believe. If patients really knew what it was all about, they would come and get checked and take their medicine.
I believe that Dr. Varghese has been blessed from the Lord with life and favor, you know, in her hands. So, and I just love that about her.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Nuts are not only a source of healthful fats and protein, they also are a massive dose of omega-3 fatty acids that can help boost your brain power.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth, and George is a very outgoing person and likes to smile and has a great smile, and so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him, we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw, and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and completed in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
That's going to wrap up this edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really making a difference in people's lives. For more information, head to our website. It's bestdocsnetwork.com. And if you have a question, a comment, or a life-changing story of your own, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com. Thank you for watching, and I'll see you next week.